There you go. Okay, hello everybody. Today I have the unfortunate news of announcing that Kansas has now surpassed 300 COVID deaths after 8 Kansans died over the weekend. Since Friday, there have been 1,369 new cases, which brings us to a total of 23,334 positive cases, 1,497 hospitalizations, and 307 deaths. In the Kansas City metro area, we've broken a record that should worry every single one of us. The largest single-day increase in COVID-19 infections since the beginning of the pandemic. And COVID-19 is not just affecting urban areas. Last week, a Facebook post about the small town of Logan, Kansas went viral. I'd like to share it with you. Friends, and I quote, "I'm asking for prayers for my hometown of Logan, Kansas. It's a small town, population around 500, located 75 miles northwest of Hays. It is being hit hard by coronavirus. The local nursing home has 35 residents, and more than half of them are tested positive for COVID-19, along with many staff members. There have been 4 deaths in the nursing home in the past week. Other people in the community have tested positive also. More than half of the population of Logan is over 50 years old, with more than half of that over 65 years old. Please extend your prayers to the 500-plus residents and all of the extended families of Logan. Our little town is hurting right now," end quote. It's not just Northwest Kansas. Last week in Ellis County, cases jumped by 30. The increase in cases mostly came from 4th of July gatherings. Not coincidentally, the Ellis County Commission voted to not enforce my mask order. As I mentioned last week, there is an increasing amount of evidence that even children are not immune from the virus. A new study of nearly 65,000 people in South Korea found that children between the age of 10 and 19 can spread COVID-19 at least as efficiently as adults do. In Florida, health officials announced that 1/3 of children tested positive for COVID-19. We don't even know the long-term consequences of COVID-19 in adults yet, let alone our children. COVID-19 isn't going anywhere. If we don't have healthy Kansans, we don't have a healthy economy. Before I get to the details of the 2 executive orders, I would like to take this moment to discuss an Associated Press story that was published over the weekend about a behind-the-scenes lobbying campaign by Kansas Republicans to get the school board to vote against my executive order. Leaders have downplayed or downright ignored the threat of COVID-19 and have used their platforms to promote politics instead of public health. As they did with my mask order, these leaders have abdicated their duty in the middle of an unprecedented crisis, putting the burden of the decision-making on local officials and school boards. Real leaders confront challenges head-on. They don't sit back silently and wait for the situation to get worse. I am taking a stand for what I know is right. I will continue to use every resource and tool available to my administration to protect Kansans and keep our economy open for business, regardless of the political pushback. So I'm asking each state Board of Education member to put politics aside and think about our children, their parents, their teachers, and the survival of our Main Street businesses. I'm also calling on all persons of influence to use their platform to support mandatory face masks, social distancing measures, and the executive orders that I will sign. Putting over 500,000 kids and faculty in daily large gatherings is the exact opposite of what health experts have urged us to do. That is why today I will sign Executive Order 2059, which does not need the school board's approval, and I will sign Executive Order 2058 after the school board votes on it later this week. Executive Order 2058 delays schools from beginning any student instruction from August 10th through September 8th. This delay will include athletics and all other extracurricular activities. Exceptions will be made for students enrolled concurrently to receive college credit. Enrollment of students for the 2021 school year may occur in K-12 school buildings. Screenings and evaluations of students to determine accommodations and placement needs for the 2021 school year. Executive Order 2059 will mandate face coverings for all students, faculty, staff, vendors, and other visitors to public or private K-12 school buildings or facilities. Exceptions will be made for consumption of food and beverages, activities that cannot safely be conducted with a mask or other face covering, or children who are not students and who are under 5 years of age. Persons with a medical condition, mental health condition, or disability that prevents wearing a face covering. Persons who are deaf or hard of hearing, or communicating with a person who is deaf or hard of hearing, where the ability to see the mouth is essential for communication. Persons for whom wearing a face covering would create a risk to the person related to their work. The executive order will mandate 6 feet social distancing except for in-person instruction in classrooms when masks or other face coverings are worn. The order will also require hand sanitizer in all classrooms and that all students and faculty must sanitize their hands no less than once every hour. Finally, all individuals entering the school building must have their temperatures checked before they enter the building for the first time every day. The additional 3 weeks will provide schools time to work with their counties to get the necessary mitigation supplies like masks, thermometers, and hand sanitizer. It will allow superintendents to thoroughly review the Navigating Change Plan from the State Board of Education to figure out what strategy is best for their district. The extra 3 weeks will also allow us to monitor the infection rate and, with everyone's help, get our numbers trending down again. Where Kansas goes from here is up to each and every one of us. As Dr. Lee Norman said last week, we can still flatten the curve and slow the spread of this disease. But that means everybody doing their part, wearing a mask, following the social distancing rules, avoiding mass gatherings, and using good hygiene practices. And with that, I'll take questions.
The temperature check requirement, does that apply to students as well?
Yes, everyone entering the building.
The argument the Board of Ed made in hesitating to do that was if you've got a high school with 1,900 students in it, that's going to take a while every morning.
You know, they're actually, in the conversation that I had with Randy Watson last week before, about that very thing when they first brought forward the Navigating Change Plan. They have been talking with their educators about how they can possibly do that. There are numerous entrances, many of which have been shut off over the years, and having all kids enter through one central location. I think they could modify that so that different students in different classes come in through different entrances, shortening the lines and the time necessary to do those temperature checks.
Governor, the state board has to approve the delay in opening.
No. I've signed that one.
You signed,
That one is signed. I will sign the other executive order after the school board meets later this week.
Governor, how do the counties in their decisions on what they did on the mask EO, do they have any power to do anything about the school's EO in the same way that they did regarding the mask executive order?
They don't. As you well know, our school boards are duly elected, and they have the autonomy to operate without the approval of the county commission.
This order doesn't explicitly speak to sports, but in athletics.
Yeah, Jonathan, all activities sanctioned by schools will be delayed until after Labor Day.
But not canceled.
I have not canceled that.
In terms of the safety precaution executive order, think about option is
I know there have been a number of conversations about how can you conduct sports safely. They've even gone so far as to think about switching them so that you take your spring sports, which tend to be more individual, and move them back to the fall, and then move the fall sports into the spring. Fall sports tend to be more contact sports, football, basketball, for instance. So that there are on that, and that is incumbent on our school districts to ensure that any activities that they sanction are conducted in a manner that protects the safety of the participants, but also the folks around them.
is there a timeline on the school opening delay consideration by the state board?
I don't know what you're asking.
The delay until after Labor Day. Is there a timeline during which, 3 days, 4 days for the state board to consider it?
I think they're meeting this week, and they will vote this week, Martin. I don't know if they could drag this out forever. I don't know why they would want to do that.
You said county commissioners don't have the power to rescind it, but then you mentioned local school boards. Could they rescind it? Is that not an option? No, they cannot do that. If you remember in House Bill 2016, the local control on statewide orders was given to county commissions. This is different than that because this impacts only our school districts, and our school districts don't operate under the same jurisdiction as our county commissions.
You made a point at the beginning of your comments about how you feel that there are certain factions working against what you're trying to do to protect the public health. Last night I was at an event where a number of Republican candidates were using words like plandemic and hoax, and they think it's important to open the economy, that there are more people hurt by that. That kind of rhetoric, how do you view that in what you're trying to do? There are people actually out there campaigning that there is no, I listened to this last night, that this is not serious, or at least casting doubt on it. How does that kind of work against what you're trying to accomplish?
Well, I think what I do is take a look at what's going on all across the country, and we are seeing a lot of folks who at one point said things like, this is a hoax, this isn't really happening, this will just go away. Those folks are really starting to change their tune. You've seen the governor in Texas, issuing a mask mandate, recognizing that this virus is no joke. It is not a hoax. It's not going away. And he's got a lot of people getting sick and dying, and he's now doing something about that. You've seen governors in other states who at the beginning were very reluctant to take this virus seriously. Now they are. And I think we're even seeing that all the way up to the top.
But Governor, the argument is that, yes, young children can get this, they seem to be getting it at a lot lower rates and certainly a lot lower fatalities in Kansas than older people. So, you know, maybe it's better for them, maybe it's safe for them to be in school.
Well, actually, John, I think the South Korea study has suggested that for kids in that 10 to 18 range, which would be what our sort of our 5th graders to our 12th graders, you know, that they are, it appears that they are as likely able to spread it as an adult is able to do that. I think the reason you don't see as many deaths among young is because they don't have, you know, comorbidity situation, don't have underlying disease. Adults getting this virus and then taking it with them when they go home. Yeah, I think I mentioned the other day when I was making remarks that I can remember very clearly the first time I sent my kids to daycare. You know, my husband and I spent years after that building immunity to all the stuff they brought home from school. You know, right now, we don't know if this virus has an immunity. You know, we don't have a vaccine for it, so we can't afford to let those kids go in, get it, carry it home to their families.
Do you think your march supposed to be safe? Do you believe your march supposed to save children? Or your march order that close the school? Did that save kids?